A very good morning to everyone who's joining us for this live webinar on the occasion of the World Continence Week, organized jointly by MSN Pharma Hyderabad and the Times of India. Our topic for today is troublesome bladder. Can it be treated? Urinary incontinence is an issue that, according to a report, affects at least 50 million people in India. It's said to be twice as prevalent among women as compared to men. It's a condition that affects the quality of life of the individual, sometimes even impacting the mental and sexual health of the sufferer. No More Leaks Breaks the Silence is a health campaign and an initiative by the Times of India to create awareness on incontinence and related issues. Today, we are joined by a panel of eminent experts in the field of urology. So please do stay with us until the end of this interactive session. Our panelists will also be taking your questions by the end of the webinar. So if you have any queries, do put them down in the comment section. Let me introduce our panel today. We are joined by Dr. R. Shanmugasundaram. He's a consultant urologist and andrologist at Fortis Hospital, Vadaparni, and an SS Urology Center in Chennai. We're also joined by Dr. A.K. Jayaraj. He's a consultant urologist and andrologist at Dr. Kamakshi Memorial Hospital at Pallikarnai. We're also being joined by Dr. Venkata Subramanian. He's a consultant urologist at R.G. Stone Urology and Laparoscopy Hospital. We have with us Dr. Pavan Arkot Prakash. He's a consultant urologist at Fortis Hospital, Vadaparni, and Abhirami New Life Fertility Center and Urology Hospital. And he's also an assistant professor at Panimalar Medical College. We also have with us today Dr. Arun Kumar K. He's a senior consultant urologist at GEM Hospital in Chennai. Welcome you all to this wonderful session this morning. I'm pretty sure it is going to be a very informative session on urinary incontinence. Let me go over to you, sir, first, Dr. Shanmugasundaram. Let's start with the basics. What is urinary incontinence? Could you explain that in layman's terms, sir?
Urinary incontinence is defined as sudden or involuntary loss of urine, or otherwise say that it is loss of bladder control. Essentially, for an individual to pass urine, two things has to happen. Number one, bladder muscles has to contract, and the muscles which are surrounding the urinary tube, which is called as urethra, has to relax. The other way around, when the individual doesn't want to pass urine and he is in the storage phase of the voiding cycle, the bladder muscles has to relax and the sphincter muscles has to go on tight. So when there is a derangement in the function of these two elements, mainly the muscles of the bladder as well as the muscles around the urinary tract, if there is an issue, it can lead to urinary incontinence. The urinary incontinence may be of two types, basically three types, like urge incontinence, stress incontinence, or it could be a mixed variant of these two. Very commonly, we see urinary incontinence based on the volume, like it's a small volume urinary incontinence, or it could be a large volume urinary incontinence. Based on these parameters, we need to think in terms of clinically, and then evaluate.
Right. Let me go over to Dr. Venkat Subramanian now. Why do you think urinary incontinence affect more women than men, sir?
That's right, Pratibha. Urinary incontinence is at least twice more common in women than in men. That's because there are certain specific events which are unique to women, which predispose them to and subject them to urinary incontinence, namely pregnancy and menopause. So we'll just briefly see what happens in pregnancy. So there is the enlarged uterus, which the womb which carries the baby, which gives pressure on the bladder. So over time, so this can cause a transient weakness of the bladder muscle. And in a woman who has had multiple normal deliveries, if there is prolonged labor, so that again can cause weakness of the muscles surrounding the bladder and the urethra, the sir mentioned, the tube which carries urine out. So these are usually transient and tend to settle in about 4 to 6 weeks post delivery. But if it continues beyond it, then a woman need to seek medical attention. And if you take menopause, for instance, there are a lot of hormonal changes which happen in a woman, which leads to estrogen deficiency. That can also predispose a women and subject them to urinary incontinence. And if you see anatomically, the urethra is much shorter in women as compared to the men. It's just about 4 centimeters as compared to at least 18-20 centimeters in men. So that again is a anatomically that subjects the women to urinary incontinence.
Right. Thank you for that. Dr. Jairaj, who can be affected by urinary incontinence? Is there a specific age group which is more prone to this?
Yeah. So urinary incontinence can affect all age groups, but it's more common in the elderly people. As Venkat said, it's more common in female, especially elderly female above 60 years of age. 40% of them are affected. The reason already explained, the hormone changes that happens during the menopause can cause urinary incontinence. In males, it's common above 50 years of age. About 30% of the male above 50 years can have urinary incontinence. But it's less common in younger age group, most probably related to nerve disorders or some neurological disorders. Young adults are affected. So it occurs in all age group, but more common above 50 years of age.
Right, Dr. Pavan Prakash, he did mention that even young adults can be affected by urinary incontinence. Could you throw some light on what are the symptoms of this? How do you identify if somebody is having a urinary incontinence?
See, basically, when a person or any male or female comes to you with the complaints of urinary incontinence, you need to ask for the complete history. How like when are they having the urinary incontinence, whether it is during the daytime, whether it is during the night time, and is there any urgency associated with it, and followed by the leak, and what is the volume that they are, how much volume of urine they are leaking. So basically what we do is, whether it is a female or a male, so we ask for a bladder diary. So we ask them to record the pattern of the urinary incontinence they're having for about 2 to 3 days, so that we'll know that what is during when they're having this urinary incontinence. So it's not just like, they come with a history that they're having leak, we'll just brand them with they're having incontinence. So we have to see the pattern, then only we can brand them that they're having so-and-so incontinence. So there are so many causes which causes urinary incontinence in males, as previously mentioned, males as well as in female. Basically, in males, mostly it is in the elderly age group or following some post-some intervention, such as TURP post, that is the surgery that is done for the enlarged prostate, or like following radical prostatectomy that is done for CA prostate, carcinoma of the prostate, or radiation therapy that is given to the prostate. So these are the few causes of urinary incontinence in males. Whereas in females, as previously mentioned, because of the pregnancy, because of the weakness of the pelvic floor muscles, and in the hormone change that happens in females, elderly males, because once they attain menopause, what happens is there is a dip in the estrogen levels. These estrogens are mainly vasodilators, so which dilate the vessels that is there around the mucosa, so which helps in coaptation, that is controlling the urine leak. So these hormones, when they dip, these vessels and all, they tend to, they don't dilate. So the coaptation, mucosal coaptation of the urethra will not happen. That's when these females, they develop urine leak. So these are the few causes of urine leak in both men as well as in females.
Right. Dr. Arun Kumar, is it true that urinary incontinence runs in families? Does genetics play a role in it?
Very good morning to all who are listening to this talk also. And as you see, incontinence is not a purely genetic phenomenon per se, but when you look at it from a children or a child point of view, sometimes neurological disorders do run in families. Even otherwise, adulthood neurological disorders, say something like a multiple sclerosis, some people do get some Parkinsonism, early onset especially, and early onset Alzheimer's. All these are predominantly running around in families. So all the sisters, brothers, the elderly people can get affected. If the father or the mother has, the children also have a possibility of getting affected. In both the childhood as well as in the elderly, these neurodegenerative conditions, that is what the term that we call, it's a loose term to group in all these type of neurological disorders, all of them can lead to varying degrees of incontinence and very difficult to manage incontinence because these problems are only managed supportively and symptomatically. You don't have a specific cure for the underlying cause. So many times incontinence is just one manifestation of the underlying nervous problem. They may be having other problems in locomotion, movement, as well as in the bowel control also. So all these factors need to be played in, and genetic, yes, it is, but it's not the predominant reason. Even otherwise, even without genetic factors, say probably 20 less than 20% will be genetic. Mostly it occurs de novo, or it is occurring from the beginning right away in an elderly is the most common, as everybody has alluded to. So predominantly in the elderly population, we see a lot of this problem. Yes.
Right. Dr. Shanmuga Sundaram, you did mention the different types of urinary incontinence. What are the real causes of urinary incontinence and how can they be managed efficiently?
Yeah, if you look at the causes for urinary incontinence, as Dr. Arun said, less common cause is a genetical cause. And most common, it can be divided into primary or a secondary. For example, primary, we don't know the reason why the incontinence happens. Like urge incontinence, overactive bladder comes under that category. Secondary causes, like he said, degenerative neurological diseases, congenital abnormalities of the spine, and certain muscular atrophies and all. And so, as Dr. Venkat said, the woman is more prone for incontinence. What causes incontinence in these group of people is that the changes which occurs in the pelvic floor and in the bladder during childbirth, during parturition, or during the post-parturitional status. The exact cause is like the changes which happens in the female urinary tract. If you take male, for example, enlarged prostate or an outflow obstruction condition, for example, stricture or meatal stenosis, all can lead to a symptom which can be a urinary incontinence. If you look at the causes or the risk factors which can lead to urinary incontinence, you can list it like overweight. For example, in anybody who is having a high BMI can have increased intra-abdominal pressure or weakening of the pelvic floor leading to incontinence. The second probably cause is that any events which increases the intra-abdominal pressure, for example, chronic cough or straining to pass motion, like a constipation, or difficulty in passing urine, namely a bladder outflow obstruction, can all lead to weakening of the muscles which support the pelvic floor, which can lead to urinary incontinence. Like Dr. Pavan said, like the other common causes is the post-surgical. Like you do an intervention with the intention to cure the patient, it can lead to a side effect, namely a urinary incontinence. For example, gynecological surgeries, namely the hysterectomies, or pelvic malignant surgeries, which is surgical oncologists perform, or removal of the bowel segments, especially rectum and colon. They all can actually weaken the pelvic floor and can lead to incontinence. And when a patient comes with urinary incontinence, we need to be vigilant to look for these causes of or the risk factors for urinary incontinence so that we can address it aptly and give a good relief. Important thing which is often missed or not thought of is the neurological ailment, especially the cerebrovascular accidents, spinal related events, and the patients may have an intervertebral disc prolapse with cord compression, all those things, which is not picked up, and you keep treating urinary incontinence, they may not get adequate relief. We need to look for the predisposing causes of urinary incontinence. These are some of the causes for urinary incontinence as well.
Right. Thank you, Dr. Jairaj. We were discussing how women are very likely to experience incontinence during pregnancies. There are many working women around. How do they how can they really manage this efficiently in such a way that they can go about their normal day-to-day life?
Yeah, the stress incontinence mainly happens because of the growing baby, stresses on the bladder, neck, the supporting pelvic floor muscles. So it might weaken the muscles. So we'll start the process during the pregnancy itself. We'll teach the patient the pelvic floor exercise or Kegel exercise. They should be doing at least 4 times a day, sustained contraction of the pelvic floor muscles, 4 times a day. They should continue post childbirth also, at least 6 weeks post delivery. They should continue this Kegel exercise, which can, since it is a self-limiting disease, most of the times it gets controlled. And other things working women can follow is there are certain lifestyle modifications they should follow. One is the obesity. The overweight can lead on to weakening the pelvic floor muscles. They should control their weight. And dietary habits. So most of them adapt to latest recent lifestyles, like taking a lot of carbonated beverages, caffeinated drinks. They should avoid this type of drinks, and they should seek an early treatment. That's more important, because we should identify this cause and get it treated. So lifestyle modification is an important thing. Working women should get cured from the doctor.
Right. Dr. Venkat, how is urinary incontinence diagnosed?
All right. So most commonly, the patient themselves will come out with a history that they're leaking urine. So you pick the cue from there, and like what Dr. Pavan said, you start asking questions to get to the cause of the urinary incontinence in that particular person. So like how Dr. Shanmugam sir said, most commonly it is primary, but first and foremost, you will have to rule out the secondary causes. For example, if this urinary incontinence is of very short duration in that particular person, you will have to rule out an urinary infection, which is the most common cause of urinary incontinence, both in men as well as in women. So, and then if the patient is having incontinence for a long time, then you go into the history of in a elderly female about their postpartum status and how many children and any particular incidents during the childbirth which they could remember. Those history is very important in getting the diagnosis. And then once you get a thorough history, there are a few simple tests which you can do on the bedside couch to elicit if the patient is having urinary incontinence. Particularly if a patient is having stress urinary incontinence, that is, they might leak urine not during normal times, but during incessant coughing, or when they laugh heartily. So those times they might leak urine. So that could be simply elicited by the bedside couch examination. And in fact, you don't need very complicated tests, in the evaluation of urinary incontinence. A few simple tests like urine examination, a culture sensitivity to look for any infection, and ultrasound, which can give a lot of information about the bladder, and a parameter called the post-void residual urine, which is how much of urine is being stored in the bladder after the patient passes urine. These are all certain critical information which can be determined by an ultrasound. So most commonly by simple and thorough history taking and a few simple tests itself can give the clinician an idea of why the patient is having urinary incontinence.
Right. Dr. Pavan, often urinary incontinence is a very difficult condition to live with, especially while going about your day-to-day activities. Could you throw some light on what are the kind of impact that it has on a patient? How does it affect the quality of life of patient?
Basically, urinary incontinence, if you see, it's more of a mental agony, especially if whether it is a female or it is a male, because whenever if they're having frequent urinary incontinence, like frequently they're passing urine, so they cannot travel for a longer distance, and even if they're in a corporate setup or a IT company or wherever it is, what will happen is that will frequently they'll not be able to concentrate on the work. So basically they will develop kind of a depression. And the most important thing is if they're frequently getting up for maturating at night, that means voiding at night because of this urinary incontinence, or it is because of the frequency, so they will lose their sleep. So it will become like again they will go and develop that depression. It will become like a vicious cycle. So basically it will affect definitely the work. So they'll not be able to concentrate because they will be constantly thinking that when they will leak. So this will affect the work process. So more of apart from the other side effects that a urinary incontinence has, like the skin rash, the recurrent urinary tract infections. Apart from that, the most important is this depression and social, and they'll it amounts to a lot of social isolation. So they will not attend meetings or functions or parties or whatever it is, because they will have the fear that they have to wear a pad or not frequently go to the toilet for frequently passing urine. So this will add a lot on their mental status. So that is why urinary incontinence as such, it is a very important I would not say it is a disease. It would say that it is an entity which has to be addressed, and it should not be neglected. And there are enough medicines as well as lifestyle changes and other modalities. If we depending on the patient, what is the severity, definitely we can take care of the incontinence. Definitely we can take care of the leak. There are enough exercises which will improve the leaks. So it should not be neglected. That is the most important thing. And you should consult a proper physician so that the problem is addressed properly.
Right. Thank you, Dr. Pavan. Dr. Arun, that takes me to the question, is urinary incontinence completely curable? If so, what are the factors that impact that?
Yeah. See, two more points I would like to add. Previously, speakers have noted, mainly what we are seeing these days in this corona sort of a year and a half, people are also staying at home. They're trying to lose weight, or some people are putting on the weight. So actually, the problem is both ways also. Rapid weight loss and weight gain. Both of them affect the urine control. So any person who suddenly loses a lot of weight, say 15, 20 kgs in a short period of time, they also tend to have the incontinence. And most of the times we diagnose this incontinence purely based on many times the patient's history. So a patient listening to what he says will lead us to the diagnosis many times than any other costly investigation into sort of managing incontinence. And also we ask the patient sometimes to prepare a bladder diary. So bladder diary is something is like writing your own personal diary, but only your activities related to the fluid intake and the urination. So number of times you have consumed the water, coffee, milk, or any liquid, and number of times you're passing using the restroom. And sometimes when you have these leak episodes, you can record them. So it gives a treating doctor a good idea as to how much is the capacity of the patient's bladder. So whether he is leaking at a small bladder volume or a large bladder volume, or whether the symptoms itself are sometimes over-reported by the patient. So that also can be picked up by the simple bladder diary, which the patient can maintain. Maybe for 2 or 3 days, he can write it down and then come to the doctor and just show the diary. So coming to your question, the management. So the management of urinary incontinence, yes, it is a very much curable condition. There is a term called as a transient or a temporary incontinence. So these are some things which are precipitated in a short frame of time. That is, people with delirium, that is due to fever, sometimes they can get urinary incontinence. Electrolyte imbalances, that is the fluctuation in the levels of salts like sodium, potassium in the blood. They can lead to an altered state of mind, and that time they can leak the urine. Even low sugars, people can tend to have incontinence in their bed, usually at night. Sometimes they would have passed urine, they wouldn't have noticed. So all these are transient. Constipation is one of the reasons for transient incontinence. And Dr. Jairaj had mentioned the pregnancy part. So pregnancy and immediately post-delivery, that incontinence is sometimes transient. Sometimes you do operations on the urinary tract also. So somebody has undergone a surgery for his prostate problem, or undergone a surgery for some other urological condition. Post-operative period, there may be a little bit of urinary leak sometimes, which again settles down. Sometimes you treat them for cancers, you give some irradiation. So all these incontinence is curable, or sometimes it improves considerably well over a period of time. And this can be a short duration, not a long duration. So mostly by 3 months, or maximum at the maximum 6 months, most of these patients are cured out of this incontinence. So first step when we evaluate a patient is to see if he has any of these reversible causes. As I told you, the salt level, sugar level, and then any basic treatable reason in his state of mind. Sometimes taking a lot of sleeping pills, psychiatric medications, all of them may trigger incontinence. So once the medication or the culprit is caught, then you can always control the urinary incontinence in a very, very easy way. And this can be done over a period of 3 to 6 months. Coming to the other common reason, the most common type of incontinence, which usually affects the elderly, that is something like a problem that Dr. Pawan told. It's more of a social issue also. It may not cause much harm to the life immediately as the other conditions, but it's something that we have to manage and live. So patient education is the first and foremost, as to look at what is the patient's expectation from the doctor. When you see him, first thing we ask is, what do you expect from your problem? Whether you want yourself to be completely dry of incontinence, or you want to get it to a level wherein you can manage, because most of them are elderly. They are dependent on somebody to move around. So sometimes in the hurry to go to the restroom, they may actually fall, trip, and they may create more problems for themselves. So we need to bring it to a level which is manageable for the patient. So that is the treatment goal. So unless we work out the treatment goal or get to know the patient's expectation, our medication we can give. We can start with A, go to B, C, D. It keeps on adding. But whether the patient is going to benefit or not is the more essential thing, and at what level to stop. So this is very important. And a lot of medications are there, but when we start medications, we always have to discuss their side effects also, especially since these medications are to be consumed, say, for 3 months, 6 months, sometimes over a year also. And being elderly, they are always on multiple other pills for other ailments, say diabetes or hypertension, cardiac problems. So our medication should not interact with theirs. Certain medications should not be combined. So all these have to be taken into consideration. But the simplest measure is to always restrict the fluids also, and reduce the intake of beverages, tea, coffee, etc. And always practice the pelvic exercises, provided the patient is also motivated and is also physically is fit enough to perform these exercises. We can always teach and train them. So that's the first line of management. Before giving the medication, start them on some fluid restriction. Diets have to be curtailed accordingly. Sugars have to be controlled. Less of juices and carbohydrates towards the evening, and also promote more physical activity, exercises, thereby strengthening their muscles.
Right. Thank you so much, Dr. Arun, for that very interesting explanation. It's very heartening to know that this condition can be completely cured as well as managed very efficiently. Dr. Shanmuga Sundaram, I want to ask you, what are the treatment modalities that you're generally followed in the cases of urinary incontinence?
Like Dr. Arun said, no, like it is actually the management is tailor-made. One treatment doesn't fit every patient. So basically, once the patient gets once we evaluate with the clinical history, examine them and get a good bladder diary, know about their fluid intake pattern and the amount of urine they excrete, then we formulate a plan. The treatment varies between mild lifestyle changes to surgical treatment. The entire spectrum of treatment is available. We start with lifestyle changes. For example, if they are obese, ask them to drop the weight. If they are taking more amount of fluid late in the evening, ask them to restrict the fluid intake, maybe after around 4 p.m. or 5 p.m. There is still low dose diuretic also helps in the late evening. Third is, if they are habit of having smoking or consuming alcohol, we tell them to quit it. Fourth, if there is any drug which can predispose or increase the intensity of urinary incontinence, we tend to stop them or modify the dosage of those drugs. This is the initial part of the treatment. Second is, and we tell them to train their bladder, basically to hold urine for a longer time, and so that they can postpone the urge to pass urine. This is called as bladder retraining or bladder behavioral modification. There are so many terms used. We tell them to hold urine for a relatively longer time than they used to pass urine at maybe the initial volume. So we tell them to postpone for 15 minutes or 30 minutes during each void so that they can accumulate urine to a sufficient volume. And the other entity is that we always combine these bladder retraining with medications. Especially once we adopt this lifestyle modification, behavioral changes, then we can actually start with the medications which are of very useful and which is of a very less side effect prone, or they are not having much of adverse effects. And there is a large group of drugs available. Maybe last 15-20 years, a lot of research have happened in this area and a lot of new molecules are coming up. So which potentially make the patient totally dry or to a reasonable extent reduce the intensity of incontinence. And apart from pharmacotherapy, apart from these drugs, we always help them with various other measures, like using a diaper, like incontinence pads or incontinence devices. If a woman has incontinence secondary to a stress urinary issue, then we can give some vaginal pessaries to support the pelvic floor, thereby reducing the chances of incontinence. And the last but not the least comes the surgical treatment. Less than 5% of individuals who have urinary incontinence may need surgery, and essentially they all surgical procedures are all focused on improving the pelvic floor or to improve the resistance in the urethra, around the urethra. Basically, this is for stress urinary incontinence, not for urge urinary incontinence. Very, very rarely we treat surgically, we treat urge urinary incontinence in a surgical manner. Like what we do, we can inject medications into the wall of the bladder, for example, botulinum toxin and all, which will help in relaxing the bladder muscle so that they can accumulate urine for a longer time. We normally don't resort to this sort of treatment. We try out all the oral medications and all the other measures. When everything fails, what we call as refractory urinary incontinence or refractory OAB, we tend to resort to the surgical treatment. Sometimes certain babies or certain adolescent children, when they born with congenital abnormalities, especially for the spine, we like meningomyelocele or myelodysplasia, they have a functionally small capacity bladder. We tend to increase the functional capacity of the bladder by surgical method using the intestines and all, which have their own innate complications, which is not free of complications. And they may have to do the catheterization to drain the bladder for the rest of their life. So we always very cautious in choosing a surgical procedure for a patient with urinary incontinence. We need to weigh the risk and the benefit carefully before we suggest a surgical procedure for these patients. So the entire gamut is available. Important thing is, like Dr. Arun said, the patient has to come out, seek for medical attention, and they can get cured potentially well. That's very important. And that's probably the theme of this entire webinar.
Yeah, thank you so much for that, Dr. Shanmugasundaram. That's one question that I want to put to you also, Dr. Jairaj. So we often find that patients are very reluctant to come forward and seek treatment for this condition. What can be the after effects in case they don't seek treatment on time? What would be the possible fallout of not seeking treatment?
So if left untreated, this can affect negative impact on the quality of life. Most of the times people think it's a normal phenomenon. As age advances, incontinence is common, and they also have a social stigma. So it affects all aspects of life. It affects the relationship, it affects the sexual life, it can affect their ability to join work and to participate in various social activities. So it should be attended to. Second thing, sometimes it can increase the mental agony of the patient, can lead on to some psychiatric disorders. So that should be attended to. And the most serious complication is recurrent urinary infection. And it can affect the bladder, uncomplicated infections. And if it is recurrent, it can ascend to the kidneys and can lead on to affecting the kidney function. So it should be treated as early as possible. Second thing is genital manifestation. If there is a patient is wearing diapers for a longer period of time, they can get genital rashes, cellulitis, bed sores. These are the various serious complications associated with incontinence. Most important thing is impact on the quality of life.
Right. Dr. Venkat, I also wanted to ask you about the latest technological advancements in this field of treatment of urinary incontinence. Could you share some of your insights into that matter?
I think Dr. Shanmugan sir has almost covered the treatment aspect in great detail. So you don't need too much of technology into treating this. So there's been most of this can be managed pharmacologically by simple medications. And like what sir said, over the years there are many classes of medicines which have been newly introduced with much lesser side effect profiles. So the patient compatibility to these medications has really improved over time. Now, only when a patient does not respond to medications, and if it's a potentially surgically treatable condition, or if it needs surgery, only then do we resort to surgery. Again, sir mentioned about the use of botulinum toxin, or Botox formerly, which we use, for other conditions as well. So that all comes into play when the urinary incontinence is, really refractory to medications. And coming to stress urinary incontinence, so these can be easily treatable by surgical procedures, which can be done even as a daycare procedure. We use what is called as a mid-urethral sling, which is basically a kind of a mesh which supports the urine tube such that it can hold urine. So these, even when we talk about surgeries for the treatment of urinary incontinence, these are not supra-major surgeries. These can be done as an outpatient procedure or as a daycare procedure. Only when the patient, has got a complication secondary to a major procedure like a TOI, they need surgery like male urethral slings to correct them. And in the case of female, they need procedures like colpo suspension, if they got a major prolapse associated with urinary incontinence. But that percentage is much less. So majority of these patients won't need, these kind of advanced surgeries or technology to treat them. Simple, they just have to voluntarily come out of their problem and they can be managed very well with medications.
Right. Dr. Pavan, do the symptoms for urinary incontinence present differently in men and women? And what kind of differentiation would you make in terms of treatment for men and women?
See, the presentation wise, as already previously been mentioned, it is basically it is divided into stress, urge, and mixed urinary incontinence. Sometimes the other incontinence, what we see in males, is something called as overflow incontinence. So where, if there is a stricture urethra or a bladder outlet obstruction, the bladder gets filled more, and then because of it goes beyond the capacity of the bladder, and then the urine leaks. So this is basically it can be seen in this male as well as in females, but because of the obstruction, what we see overflow incontinence. But otherwise, per se, there is nothing like females will present incontinence in a different way, males will present incontinence in a different way, nothing like that. So both of them can present, they can have any of these incontinences. And the other part of the question, what you are coming to that. So these incontinence, once they notice it, the only thing is they have to come out. They have to be aware of the side effects or the complications, also as already been told. Because if they don't come out of it, so it can affect professionally the work, as I told previously, as well as the personally. Like, it can cause anatomical changes. It can cause upper tract changes. That is, it can affect the kidneys. So they have to be aware of it. Whether once they notice it, if they're having it for quite a long time, if it is not, and simple things like urinary tract infections and all, everything has been ruled out, they have to address the incontinence.
Right. So regardless of the gender, the type of urinary incontinence is what should be addressed, is what you're saying, Dr.
Yeah. So the females and males, so they don't have any, particularly like, females will have this incontinence, male will have, no, there's nothing like that. So incontinence is incontinence per se. So they can have, but yeah, the cause can be different. It can be because of the stress. It can be because of the urge, like, mostly because of the overactive bladders or neurogenic bladders. The cause can be different, but the presentation in males and females, there is nothing particular about it.
Right. Thank you for that. Dr. Arun Kumar, considering the number of people who generally suffer from incontinence at different points in their lives, is there any screening test available to probably detect or foresee them having urinary incontinence at a later stage?
Yes. Before that, just another couple of more points, Dr. Venkat's talk.
Sure.
Basically, because we are living in this app age, we are actually having more apps also to map your restroom, map my restroom. Okay, so many times patients with incontinence were basically scared to go out. So because they may get the sensation to pass urine anytime, and if they leak, it becomes an embarrassment. So there are apps available wherein you can search your nearest restroom so that they know, okay, if they're going to say X place, what is the route that they are going to take and how accessible the public restrooms will be. And our country should also sort of work forward to create more such places so that people are feeling safe to go out, especially the poor population bothered by the incontinence. And the other latest advance that comes up is mostly using sort of electrical stimulation or surface electrodes, which the patient can be having as a body-worn gadget, which will activate his pelvic muscles whenever the urge comes. So these are all places where research is going on. Government-sponsored projects are there. A lot of research is happening. So that apart from all the pills, because tablets you need to take daily, sometimes you forget, their pills have their side effects. These things are basically like an electrical stimulator. They run on battery and they run on current. So they can stimulate the pelvic muscles and automatically sometimes suppress the urinary bladder also, and thereby prevent the incontinence episode. So all this is basically giving them more freedom to enjoy life. And coming to the main question that was put to me on the screening. So incontinence, more than the screening, we should always address this problem right from childhood also. Sometimes we are too strict with our own toilet training regimes. So when children are very small, and sometimes they are not allowed to pass urine at their liberty. Sometimes in schools, they are forced to control. So this habit of the nerve system usually learns by training. So the entire nervous system, when from childhood to the adulthood, it always keeps a memory of what's happening. So if you do something in some way, the brain always has a record of it. So when the child is being managed in such a way at home or at school, when they are very strict about the breaks, so what happens? The child learns the habit. So it's a self-learning, and then they always keep controlling the bladder. So sometimes this may lead on to future problems. Sometimes you may also have peer pressure that if you pass urine frequently, somebody makes fun of you. All this happens at school level. So children have to be sort of educated out of it, as well as the parents have to be more importantly given education that sometimes it's not wrong for the children to use the restroom frequently. It's all not to be chided upon. And screening per se, there is no specific screening as such in form of a test or something. But yes, certain patient populations, like those with nervous conditions and people with even urinary abnormalities, like an enlarged prostate for say, or sometimes those with a weak pelvic floor muscle, that is people who are having problems with defecation, there is motion passage. So they can also be simultaneously having problems with the urination also. And look for always neurological conditions, vitamin deficiencies, usually the B vitamins, which generally control the nervous system. Sometimes you have a deficiency of those things happening in populations who take a lot of vegetarian food also. So sometimes you need to treat the vitamin deficiencies, and thereby try to create a healthy internal environment. The muscles should be good, the nervous system should be good. So screening helps to identify if there is any weakness in these areas, and probably those patients are at a greater risk. So improve your healthy lifestyle so that you don't get into this incontinence, but sometimes it is still inevitable. So water intake, as you grow older, we need to sort of restrict our fluid intake also, because this has been spoken to by every speaker, which means that they are giving this advice to every patient, and it is the first and foremost advice that everybody gives. So fluid restriction, reduction of the beverage intake. So all this helps to prevent the development of urinary incontinence later in life due to any other condition.
Right. Dr. Shanmugasundaram, we learned about how to manage incontinence, using various techniques. Now, what is the role of a family and friends in society at large in helping a patient manage it efficiently?
It plays a major role. Like apart from clinicians, where we spend the time, maybe 10% of the patient's time with us, the 90% of the time is spent with the families. See, they need a lot of support, as it causes huge embarrassment, agony, as Pawan said. Like it involves like a huge social trauma. So what they need emotionally, psychological support, of course, financial support also from the family, because they need to buy these drugs, devices, and various tools to control this urinary incontinence. One day we all will get old, and we will go through the same phase what our seniors are going through. That should be the probably thought, and we should help them to bring them to the medical attention, evaluate them thoroughly, and provide the adequate care. It's very important to make sure that it is happening. And apart from the family, the social groups, there are so many social groups available, and where they can share the problems, they can find out the solution, they can reach the hospitals which are specifically specialized in this treating these conditions. And they can and you can actually look for advertise more in the public forum as well to create awareness. Like this program, people will be aware, get more awareness, and then bring the patients to medical attention. We have seen in clinical practice, like grandson bringing their grandparents for, after knowing that these entities really exist and our grandparents are suffering. And it will cause, it should be more aware in the society to get a good health care. Apart from what Dr. Arun said, there is a recent improvement in the treatment of urinary incontinence. It's specifically for those who are affected neurologically, like what you called as sacral neuromodulation, where it's like a pacemaker of the heart, where we implant a pacemaker device in the spinal cord or paraspinal region, which send the signals to the bladder when to contract, when not to contract. It can be easily managed by the patient themselves. These are few recent advancements available in the treatment of urinary incontinence.
Right. So, Dr. Jairaj, I wanted to understand, it is said that this condition is quite curable, it can be managed efficiently. So, what is the post-treatment care that a patient would need after undergoing this treatment? And can they have the same quality of life as before?
Yeah. So with the variety of options already discussed, certainly this incontinence treatment will have a positive impact on patient well-being. So the need for repeated hospitalization is decreased, and 90% of the patients will have a positive response to whatever the treatment we have advised. And the family bondage increases because most of the times elderlies are taken care by their children. The family bondage increases, and the relationship issues with the spouse also decreased with incontinence treatment. So these are the various positive aspects of getting treatment at an early stage. And we can also detect some serious underlying disorders. Sometimes some patient with cancer, bladder cancer, can present with incontinence. So we can detect some serious underlying disorders with early treatment. So overall, the quality of life with dietary habits, lifestyle modification, and surgical intervention if required improves, and 90% of the patient will give a positive feedback to the other family members or the patients who need the treatment. So certainly we should go for early treatment.
Right, Dr. Venkat, on that note, I also wanted to understand what are the challenges that you have when you have patients coming from rural areas? Is there enough awareness about this, especially among the rural patients? And what are the challenges that you normally face?
Generally, people tend to think that leaking urine is a stigma. So forget rural. Even you find that well-educated women, they don't seek medical attention, as soon as the problem starts. More often than not, you will find that they come, after experiencing enough agony. So I think that's when the role of the family also comes into picture, like how Dr. Shanmugam sir mentioned. When you find your wife or mother, going to the restroom far more often, and when you find their garments wet, and I think they will more easily open out to you than to anyone else. So the role of the family is is again and again emphasized, because you need to bring the concerned person to the physician to seek medical attention. So as far as the rural is concerned, yes, I don't think it's any different. We come across patients from rural with very bad leaks, very significant leaks. Sometimes even the the room gets very stinky because they leak so much of urine, and you tend to think how they have managed to live so much with it. So yes, the awareness needs to be increased both in urban as well as rural areas, that this is not a stigma, but it's just a condition and they need help.
Right. On that note, Dr. Pavan, I also wanted to ask you about the stigma that people have. Why do you think people refuse to get checked for this condition, and how can that be addressed?
Before that, I would like to add few points. See, we've been talking about this incontinence, mainly females and males. So there is a huge number of patient, that is especially children, who suffer from this incontinence because of this spinal problem or neurological problem, what we call as neurogenic bladders. So because of this, they develop a lot of stigma. No, the kids, especially in this, when they start going to the school, they keep on leaking urine. So after a period of, because there is a lot of embarrassment and the bullying that happens in the school. Again, the teacher also, we also you have to tell the teacher that, if the student keeps on asking that I have to go to pass urine frequently, they should not think that the student is giving some excuses to get out of the class or something, and the teacher should come up and address, or they should talk to the parents that the child is frequently going to the bathroom, so that the parent also should be aware of there is something wrong, that the child is not intentionally doing it. There is something wrong that is actually happening with the child, and the parents should consult the doctor or somebody who is, or therapist, whoever it is, and see that why the child is having this problem. If you just ignore it, it can lead to a lot of problems. And especially, and also we see so many patients, parents bringing their especially female child, that so and so my child has been leaking for this one. What will happen to the her future? Will anybody marry her? Will there be a marriage issue and all? So they should, these stigmas and all, they should be aware of. These problems they should be aware of, and then they should consult a proper physician or a urologist, and make sure that these problems can definitely be overcome. So these are the stigmas that they should, be aware of.
Right. Taking off from Dr. Pavan's point, Dr. Arun, I would want to pose this question. What should people look for in a facility when they're choosing a facility to get treated for urinary incontinence?
The urinary incontinence is multifactorial. So we have been seeing so many reasons. So when you choose a facility for a treatment, basically women, they require a gynecological support. Gynecologist has to examine the lady to rule out certain causes for incontinence. Then you need to do a neurological evaluation, the nerve system. So you need to have a neurologist around, and then you need to have the urologist, who is the primary treating doctor here for the incontinence. So this facility is a must. Apart from that, the support staff, because as we have all seen, incontinence is something the clinician spends a little while with the patient, but who is going to train and teach the patient all these exercises, which we are actually telling you, do these exercises, it will improve. But you need somebody to teach the patient. After teaching the patient has to perform the exercise or the whatever maneuvers that the patient has been taught, and somebody has to verify it. So you need a good nursing staff who have been aware of all these incontinence therapies and motivating. So they should be repeatedly following up with the patient also. So it's not like he comes in today, then I say I give some pill, 1 month later you come back. But that 1 month should be spent motivating the patient to get it done. So periodic calls over the telephone, or if possible, if the nurse can pay a visit home to see what exactly is the situation at home, whether he's able to do it or not, and also the backup, what is the family backup that's available, is very essential. So the overall package, it's not just like the urologist alone. You come here, you get treated. It's the entire team of the specialists that's needed, and also you need a facility which has got some testing tools also available, because you need to do some tests in patients, uroflowmetry, a urodynamic study. Sometimes you do something called as a video urodynamics. That is, with the fluoroscope, we are actually identifying with an X-ray at the same time with the computer sensors how good the patient is passing the urine, and where and exactly why the leak is occurring. So this testing facility is also required, and usually it's a multi-speciality sort of a care situation.
Right. Thank you for that, Dr. Arun. I'm just going to interrupt this conversation just to remind our viewers that we have a panel of experts here who would be willing to answer all your questions. So please do post your questions in the comment section. We'll try our best to get them answered by the expert panel today. So we will move on, and I'll ask one question to each of you, which is about how can we increase the awareness levels among the population about urinary incontinence. I will start with you, Dr. Shanmuga Sundaram. Could you tell us what can be done to improve the awareness among people?
So basically the awareness, the teaching or education, whatever, should be starting from the primary school level. And we should teach them what is proper bladder training, what is toilet training basically, and what are the red flag signs. If you have these symptoms, you need to go to a medical attention. You need to start the education right from the primary school level. And if you publish in the newspapers and all, apart from celebrating this week or particular program, we need to create a periodic awareness programs. Like we need to tell them, educate the public that these are the things that can go wrong in the urinary system. We often see many patients in the clinic, like they don't have a basic awareness about their well-being, or the cleanliness in the genitalia. All those things need to be taught. Then we need, like Arun said, mapping of the urinals basically. And probably it all comes under the, if it is included in the Swachh Bharat also, it should be very well. And we need to tell people where the urinals are available nearby you, so that they will be very confident going out without any worries of incontinence. Apart from awareness, we need to subsidize. Like these products are not very cheaper one. We need to subsidize these medications and the devices, and encourage more amount of research, especially inland in India itself, to improve these devices. Because currently we all import these devices. There is no major makers or manufacturers in India, especially the incontinent devices and these stimulatory devices and all. And even the devices, the instruments where we, like urodynamics and all, we still importing. There is no major providers within the country to supply the entire urological community. So we need to step up in all these measures.
Thank you for listing all those concerns, Dr. Shanmugasundaram. I hope everyone can take note of it. And this is a good way of spreading awareness, by talking about it during the Continence Week. Dr. Jayaraj, let me pose the same question to you. What do you think can be done to increase the awareness about urinary incontinence?
Yeah. So one thing is the social stigma on the part of the patient as well as on the part of the doctors, the primary doctors. So the patient should tell their incontinence or urine leakage symptoms to the doctors, the primary physicians, as well as we also should ask the patient about their incontinence. This is a primary thing, because with a lot of options, early treatment will help the patient. Second is by social awareness programs like this, we can make the patient aware of the treatment options and what are the positive feedback about the patients who already got treatment. The positive feedback can be helpful for the patients. And we can start incontinence clinic. That is certainly needed in our society, so that the specialized will give latest advanced treatment to the patient. So these are the ways we can increase the awareness among the patient.
Thank you for that, Doctor. Dr. Venkat, what would be your inputs on that?
I think TOI has taken a step in the right direction in creating awareness about this in the digital platform. I think, it needs to come to the mainstream media as well. It should reach as many people as possible. And like how we have awareness about tobacco and alcohol in, before start of any feature film. I think, once in a while, there should be ads about these, conditions which require social awareness as well. So I think this condition needs awareness in the mainstream media as well. And like how Dr. Jayaraj said, there could be an incontinence clinic. Now we have, for example, pain clinic and things like that. So at least it gets the patient thinking, oh, okay, so there is something to, attention has been focused on this particular symptom such that there's specialized clinic for it. So I think we should have specialized clinics like incontinence clinic. I think at the national level also, we have an International Continence Society, because when it has been considered as an international problem and a society has been formed to raise awareness and discuss many issues about, at the national level also this should be taken up, and there should be a national society or a body to raise awareness and discuss these issues.
Right. Dr. Pavan, what would be your insights on the subject, sir?
Regarding the awareness, so more than educating the people, so we also have to know that we have to tell our fellow gynecologists or obstetricians who are practicing, so that post-delivery, they should always advise, because in India, with so much of population, with so much of deliveries going on, so once a delivery is done, so they will only look at the wound infection and as well as the vaccinating the child. So then after that, we will not be educating or telling the patient that post-delivery, they have to go for this pelvic floor muscle exercises. We have dedicated physiotherapists who are there. So post-delivery, they should be, the pregnant ladies, they should be made aware that they should regularly practice this pelvic floor muscle exercises post-delivery. And the second thing is there are so many NGOs so that people are not aware of. So where they support this the overactive bladders and helping them with coming with the reduction of the cost of the drugs. They will give the drugs for free. So these NGOs should be made, should be made public, or the patients, the people should be made aware of that. So and so NGOs are available. That should be in my points to add on the awareness.
Thank you, Dr. Pavan. Dr. Arun Kumar, what would you like to say on the matter? Do you have any additions to that?
Yes, we are actually going through a health revolution per se, because the entire healthcare system in the country has been scrutinized, and actually is for the good. So you're finding out a lot of deficiencies and correcting them. So this is exactly the right time for people who have already told also, start an incontinence clinic at least in every medical college hospital. So to get the patient where to go, so he knows where to go, whom to treat, whom to see, and also awareness at the grassroots level, sensitization of the people through media at the same time, advertisements, and also promoting good health practices like avoidance of, as we told, beverages, and also smoking should be stopped. So all these things are already going on. So we can actually portray that these are also going to prevent these urinary issues also in the future. And awareness for any urinary symptom, have also a helpline. Usually these days everybody have to use their phones for most of their things. So for them, it's always easy to either chat with somebody or call up somebody rather than going out of their homes and looking at the advertisement. So you have to get that advertisement to the patient. So better to have something like an helpline which can be open, have a society, and that society can set up a helpline, and the helpline can actually answer patient queries, and that itself can filter out, reduce the anxiety at the same time. Suppose somebody has a urinary incontinence for a day or so, you can tell them it might be temporary, it will settle down. So it reassures them. On the other hand, if they are bothered for a while, you can always invite them to the hospital or a proper place to evaluate, and then give them guidance. So this will actually help us a lot.
Right. Thank you so much, Dr. Arun. Now let me go over and ask you, put the audience's questions across to you. I would suggest that any of you please feel free to jump in and answer the questions if you want to. So the first question is from one KB Murali. He says, "I'm diagnosed with BPH. I am having dribbling for the last 2 years. Doctor has prescribed Sildo 8. Now I'm getting headache every morning. I also have SCA 13. I don't know if this makes sense to you. So wondering if any of you would like to answer that question.
Probably I'll take.
Yeah, sure.
What is his age? Anything written there?
No, he's not talked about his age.
So usually the BPE or BPH is one of the cause for concern in men. Like what he says is, after passing urine, he drops urine. This is basically called as post-micturational dribble. The important thing to rule out here is to do an ultrasound to check how much is residue, like what is inside. If he's not emptying it carefully, like emptying it completely, then probably his dribble will continue. And probably a urologist only, one among our colleague only would have given this tablet. It will help, but you need to elaborate on the evaluation. You need to get a good checkup, especially the post-void residual urine. If he is not getting benefit with this medication, probably you need to move on to the next phase of treatment. Probably a surgical treatment may be required.
I hope that was helpful, Mr. Murli. Now, my next question is from another viewer who says, my dad is on silo fast. However, he needs to visit the restroom every 1.5 hours in the night. He consumes about 2 liters of water. How much of water should he take daily and to pass urine less frequently?
Okay.
I'll take this question.
Sure.
Yes. So basically what he says is having excessive nighttime urination, for which actually the medicine is also being given. So apart from the problem, it can also be due to the age, cardiac status of the patient also needs to be assessed, because they produce more urine in the night rather than in the day. So it's not just the bladder alone. Sometimes the volume of urine that reaches the bladder is more, so he has to get up and pass urine more frequently in the night. So apart from the slow fast that is already being given, we can also add sometimes, if necessary, another drug to reduce the frequency of urination, and probably look at his fluid intake more stringently, keep it to 1.5 liters and be more strict with the timings, say 7 or 8, and then switch off the water intake. So by doing all this, maybe we can reduce the night urination to probably 2 or 3 times in the night.
Right.
Many often know people who snore in the night, they tend to become dehydrated. They may have a dryness of mouth, so they keep drinking more amount of water, and they, in turn they will go to washrooms very frequently. For them, you may have to restrict the fluid intake. If you feel thirst, don't swallow the liquids, like gurgle and spit it out. So it will be a simple advice. It will reduce the frequency to a greater extent.
And often these people, they have a tendency that they every nighttime, they frequently, they are getting up. Every time they get up, they keep on drinking water. So that they have to avoid, or just, I think over a period of time, once they make a habit of it, I think they can avoid it. Every time they go for urine, they can keep on drinking. Again, they keep on. So that has to be avoided.
Right. Okay, my next question is, what type of treatment is best for post-menopausal urinary incontinence?
So, Venkat.
Dr. Venkat, you would like to take that?
Yeah. So again, we need to categorize what kind of incontinence this patient is having, whether she is having urge incontinence or is she having a stress urinary incontinence. I think universally one can, I think Dr. Arun mentioned, the Kegels exercise, Dr. Pawan mentioned. So this Kegels exercise is a very important rehabilitative exercise, which can start from the time of pregnancy and continued religiously, into post-menopausal age group as well. So this will be a very useful tool in women to prevent urinary incontinence. So, if this, in case of a post-menopausal woman, if she's having stress urinary incontinence, if you're diagnosed, it to be a pure stress urinary incontinence. So again, the history plays a role. People might have a mixed incontinence. They will have both urge incontinence as well as stress urinary incontinence. If it's a pure urge incontinence, it can be handled with medications. And if it doesn't settle with medication, the patient has got stress. Again, there are certain medications which can be useful, but more often than not, stress urinary incontinence is effectively treated with sling surgery, which you mentioned.
Right. Apart from what Dr. Venkat said, you have to examine the local vaginal mucosal status, estrogen status of the woman. So many postmenopausal ladies will have like urethral atrophy, vaginal atrophy. In those ladies, probably supplementing with the local application of estrogens might be helpful for a while. It should not be continued for a very long time, and it should be given only after screening for particular malignancy, for example, breast or endometrial carcinomas. If they have a family history of breast carcinoma or endometrial carcinoma, estrogen supplements has to be taken with care. It should be evaluated thoroughly before you start.
Okay. There's one more question from a viewer who asks, doctors, is there a specific exercise which can reduce incontinence, and can you name a few for adults to follow?
We all been discussing this, like a Kegels exercise and all, but we don't know whether people used to say that there is some yoga mudras available to improve the pelvic floor muscle tone and all. From allopathy, we won't know about this. There might be, but if you get a guidance from a particular person, probably it will be useful. And apart from these pelvic floor exercise, nothing else to promote actually to improve the pelvic floor tone or to reduce the bladder contractility. There is nothing else.
I would like to add something, sir.
Yes.
So the most important part of the pelvic floor exercise is, see, the people, we just tell them that do pelvic floor muscle exercise. They also will go and try out something, the Kegels exercise there. So the most important part is they have to identify that which muscles they have to contract. So that if they identify, because if they will be, once we ask them to do that, so they'll be contracting the thigh muscles and the buttock muscles, what we have in this one. They have to identify that. So if you go and search for Kegels exercise in YouTube, there are a lot of videos available. They have to identify that what is the muscle exactly that has to be contracted. So if they do that, so that will be much more effective rather than just simply doing the exercise.
The best time to teach them Kegels exercise is when the clinician examines the patient. When they do the pelvic floor assessment, we tell them to grip the finger with the muscles and keep the counting for 1 to 10 or 1 to 15. That's the time we can learn the pelvic floor exercise properly.
Right.
As a policy, like we also should be teaching them when we examine. That's very important.
A lot of good points being made over there. I think we've run out of questions from the audiences. So before we wrap up, I would just like to ask each of you, what you would like to say as a message to the audiences at the end of this webinar session. It's been a very informative and insightful session for most of us who've been logged in through the entirety of this conversation. So let me start with you, Dr. Shanmugasundaram. Could you tell us what would be your final message to the audiences who are viewing this session, sir?
Urinary incontinence is a symptom. Don't consider this as a part of aging. You just seek attention and get the cure. That's what is important.
Thank you so much for that. Dr. Jairaj, what would you like to say?
Yeah, with lifestyle modification, more than 50% of the incontinence can be prevented or corrected. So adhere to the lifestyle modification doctor has advised, it can help you a lot. Then follow it throughout your life. That's important.
Yes, Dr. Venkat, what would you like to say, sir?
So any leakage of urine is abnormal. So whatever message you got out of this webinar, we have discussed so many causes and so many conditions which can. I know the bottom line for the viewer or the patient is any leakage of urine is abnormal. Just go ahead and seek medical attention.
Right. Dr. Pavan, what would be your final message to the audiences who are watching this?
Yeah, apart from, of course, awareness is one thing that people should be aware of. And the most important, the most common thing what we regularly, that's what I would like to tell. The most common thing what we regularly keep on consuming, even in a corporate setup or in a, in an office and all, is what is coffee. So I think there should be some flyer or message written right beside the coffee vending machine that the more you drink, more you're going to leak. That should be there, because apart from alcohol, we don't consume regularly. So coffee is a regular thing that we keep on consuming. That should be there, and of course, the awareness is very important. The treatment is there. Not necessarily that everybody has to be treated with medicine and surgery. It can be treated very much with lifestyle changes, as Jaira sir told, and lifestyle changes and weight reduction and exercises. Very few percentage of people will need medication, and very few people will need surgeries. So it is a very much treatable symptom as a whole. So the awareness is what is mostly required.
Thank you, Dr. Pavan. I'll keep that in mind because I'm a hardcore coffee drinker. So Dr. Arun, what would your final message be to the audiences?
The only point we need to make is awareness and motivation, because for seeking the treatment, undergoing all these exercise, everything you need motivation on the part of the patient, as well as motivation on the part of the family. So support patients with overactive bladder, bring them to the designated care centers, and make sure they're able to conquer their incontinence and have no leaks.
Right. Thank you so much for everyone. So with that, we come to the end of this webinar, No More Leaks, Break the Silence. It's a health campaign and an initiative by the Times of India to create awareness on incontinence and related issues. Thank you very much, doctors, for joining us today. Dr. Jairaj, Dr. Shanmugasundaram, Dr. Venkat Subramanian, Dr. Pavan, Dr. Arun. Thank you so much for joining us and sharing your insights and making it a very lively, interactive session. I'm sure the viewers have got like a lot of points to take away and understand more about urinary incontinence, the treatment modalities involved, and how it can be cured, and how one can live a very quality life even after surviving this. Thank you so much for talking to us. We hope to connect with you in the future and have many more informative sessions like this.
Thank you. It's a
Thank you.
pleasure.
Thank you.
Thank you.